I am a Black trans woman, 49 years old, and my coming out years, as it were, is really when HIV just had a stronghold over everyone, all LGBT spaces, even from my earliest adult memories, from my first year of college and all of those things. I just remember people dying, and this is before AZT, and this was before, certainly before antiretroviral therapy. And many of us just felt helpless. And I think certainly in Black communities and in Black spaces, there was almost this sense of doom, this inevitability that it was going to take everybody in our circle. In some of the circles that we roamed around in, it did take everyone. The first thing that comes to mind when I think about the transgender community and AIDS are barriers. I think about all of the barriers that society in general puts on trans women. I think of all of the barriers that society puts on trans women of color. I think of all the barriers that society puts on Black trans women. And I think of all of the barriers that are in place if you're all of those things and then add HIV to the mix. The Human Rights Watch has identified homelessness, health, and employment as three of the top barriers or things for trans women, particularly as it pertains to HIV. And certainly they are three of the top. But depending on where you are in the country, those three things would change quite a bit. If you're in a place like New York, where there's systems in place that would automatically ensure that a person would have access to health insurance, regardless as to their HIV status, then health may not be a top priority for a person. If you're a person who is in San Francisco, for instance, and in San Francisco, not just are you able to get preventative care like PrEP services for free provided by the state, but you're also able to get gender affirming health care. For those of us who live in the South, there's no guarantee of those things. Certainly, there are very few options for folks. Accessing those options is even more difficult, and there are levels of privilege even among those of us who society deems as the most marginalized. In general, HIV is now considered a manageable disease. However, what we're finding is that in Black and brown trans communities particularly, we're not seeing a lot of the benefits of modern medication. We're not seeing a lot of the benefits of the Ryan White program, of all kinds of different prevention strategies. That's post and pre-infection. Our rates are more than 1 out of 2 people. More than 1 out of 2 Black trans women are going to contract HIV during our lifetimes. The thing is, there's some places, especially in the South, where there are statistics that are as high as perhaps 75. We've seen some raw data that suggests maybe even 80 or 81% in some rural counties. So when we look at more recent, the small data sets that are available, we're seeing that with Black trans women, we still are dying at earlier rates. We still are more apt and more prone to have an AIDS diagnosis, which is a medical diagnosis, versus simply an HIV diagnosis. We're also more apt or more prone to be out of care or less retained in care in lower numbers. And all those things really impact our quality of life. It impacts the length of our lives. It's really, we are where the country was 30 years ago. Paying for preventative care is really, really expensive. PrEP itself, with patient assistance programs, is not expensive. However, the lab work that goes along with it that is necessary to remain on PrEP can be very, very expensive. So if you're trans woman or trans man who is unemployed or underemployed, then being able to pay for lab work every 3 to 6 months could be nearly impossible. We know that statistically speaking, Black trans women in the South earn less than $10,000 a year. So if I'm earning less than $10,000 a year, then my first priorities are going to be that I have a safe place to live, a safe-ish place to live, and food to eat. And so lab work for something that I may or may not have is not a priority for me. When folks got sick with, AIDS back in the day, we were the ones who took care of ourselves. There were girls who were performers who had benefit shows to make sure that folks were buried with dignity and that they lived with dignity. They built tribes and they built community and created a sense of community that unfortunately many folks that I see now don't have. I love telling people about the Star House. Marsha P. Johnson and Sylvia Rivera in 1970. They created the Star House, and it was a place that transvestites, which is the term that was used, we would now use the term transgender or transsexual folks, that transvestites who were homeless could come and stay there. And so as a person who works in public health, I often hear, well, we don't know how to get trans women off the street, so we don't know where to place them. Well, 49 years ago, two hookers and whores in New York City figured out how to do it. Yet we can't figure out how to do it in a major city like Atlanta, where one of the health departments just got $33 million. It is important for the system to trust us to take care of ourselves because we've been doing it all along anyway. But give us a little help. One of the greatest challenges that's still facing trans women, especially Black trans women, is a lack of funding. I talk about the statistics and I talk about data, and it's important to understand that data and statistics represent money and they represent people. The CDC is in our backyard here in Atlanta, our proverbial backyard, and the CDC just started including trans people in data sets 3 years ago. I've been in Atlanta 10 years. So I know at least there was one Black trans woman in Atlanta. So that's ridiculous. And so it is important for us to make sure that we're counted and that resources available. And invest in us. Invest in us. We've lived this long without anyone investing in us. So it is going to be important that the systems that are there to take care of us invest back in us. We're seeing more Black leadership at all different levels of government and of HIV policy and care. So let's see more Black trans leadership because, again, we're the most impacted community.